All right, I think we're going to get started. Thank you all for being with us today for a genetic counseling webinar to really talk about the field of genetic counseling and to invite many diverse types of people to be part of our field. We need you in the field of genetic counseling. We want you in the field of genetic counseling. And today, one of our goals is to show you all of the different ways that genetic counselors can interact in the field. And so let's get started. I'm the president and CEO of Gene Counsel, a digital health company in the area of genetic counseling and testing. And with me today, I have my co-founder, Danielle Bonadies. I also have Megan Farmer, Caitlin Kingsley from the Gene Counsel team. And we're very excited to introduce our speaker. But first, let me bring up a few housekeeping items. This is a 1-hour webinar, and we're going to have our speaker will speak for about 40 minutes, and then we're going to have time for questions and answers. Please utilize the chat function throughout the webinar, and we'll take your questions as they apply or at the very end during our question and answers. The session is being recorded. Everyone will be muted. And as I mentioned, please take advantage of that chat feature throughout. Also know that if you are registered for this webinar, you will receive the recording within 24 hours. And so now I'm very pleased to introduce our guest speaker today, Sara Pirzadeh-Miller, who's the Associate Director at the Cancer Genetics Program at UT Southwestern Medical Center. And so Sara has done some really innovative and interesting things in the field. She's a leader in the field. We feel very fortunate to have her today. And so with that, Sara, I'm going to have you share your slides and we will move on with the webinar. Oops, Sara, are you on mute?
Can you hear me now?
Yes.
All right. Thank you for that. Sharing the screen. Can you all see that?
Yes.
Great. Well, thank you, Ellen, and the Gene Counsel team for inviting me to speak today. I love talking to folks who are thinking about our field, a field that I'm incredibly fortunate and passionate to be a part of and have been now for longer than I care to say, but I'll say it anyway as I talk through. But also to be where I am now and to be in the institution that I'm in and just to kind of talk through how we got to this place and how my program got to this place. And I think the steps that led me and us in this direction. And I look forward to your questions as well. So I'll kind of tell this as a story from the beginning and how I really got into the field and discovered this and the steps that I think kind of took me to where we are in our program now at UT Southwestern and some highlights of really exciting things that we've been able to do as a team and things that I've been just fortunate to be a part of and leading and, kind of all pieces of the team. Because for us, without the team, it wouldn't happen. I mean, all the different things that we do. So I'm so fortunate to be a part of the team that I am. So I love telling prospective students or folks interested in the field that, a lot of people don't know what they want to do from a really young age. And I find that as I talk to, I know I have some of our current genetic counseling assistants on the call today, and other folks that I've talked to are saying like, I discovered this in high school or I went to college and I heard about it. And, given how old I am, the fact that I found this term of genetic counseling really young still kind of astounds me as I kind of, think about progress through the field. But I really discovered the term in my own research as a middle schooler, but always knew I wanted to be in genetics from a very, very young age. And just love the biology, love the hardcore science. Thought I wanted to be a genetic engineer way back in the day because my dad was an engineer a different type and was mentioning different types of engineers. But then I discovered genetic counseling as I was doing research and figured out, oh, there's a profession that does the hardcore genetics, but also helps people and educates. How amazing. And I know many of us have stories like that. So I discovered that and was really, that was my path. That's where I was going, really from 7th or 8th grade as I was, in biology classes and things. So anyway, I was very excited to continue pursuing my genetics education at Texas A&M University. For any of those out there who are Aggies or no Aggies, whoop and gig 'em. But such a fabulous place to pursue my genetics education. I got my bachelor's in genetics there. And had amazing mentors and amazing experiences. And I think, some of the formative experiences as I think about leadership roles later and some of the things that really shaped me from an earlier time was a lot of involvement, not only in my, working with folks in my major as a genetics major there, but going into, different pursuits like our, leading our bioethics society and our genetics club. And I know many of you out there have, some experiences of interfacing in an undergraduate space with some of that. But I kind of got into planning an international conference in bioethics. And so I got a lot of fantastic leadership experiences and things from that perspective. And I put myself in a lot of situations to just to kind of broaden my horizons and do things I was excited about. And I think that some of those things and the people I met and the mentors I had were really formative in that. And, it was interesting back at that time, and unfortunately it's not totally different now, but at Texas A&M as a genetics major, my mentor and many others had no idea what a genetic counselor was, what we do, why it was a good idea. All they knew is that it was a master's degree and it wasn't an MD or a PhD, and that's where they thought I should be going. So it kind of makes me laugh now because, you're at a time in your life where you want to absorb all the things and you want to, and your mentors that you respect. And so I definitely explored a lot of options. I worked in a lab and I did all those things. But I had to get away from campus a little bit to really remember why I was there. And so I applied for a public policy internship in Washington, DC, the summer between my junior and senior year. And I was able to go to DC and work in the public policy space where it interfaces with genetics and go to Capitol Hill meetings and did a lot of really cool stuff with an internship with the Association for Women in Science in DC at their headquarters. And it was just a cool opportunity to get out of what I was used to at campus and all the work I was doing there, go do new things and remember why I was there and get back to what my passion was. And I thought to myself, I've explored MD and PhD pathways and things I could do, and they're cool and exciting, but man, genetic counseling is still where I want to be. And I was able to rediscover that and get really cool experiences as a part of this internship. So that was a really formative piece for me. And just a new experience to kind of put in my, kind of a tool in my toolkit, if you will. So there was a lot of those types of experiences that then, were able to, really kind of assimilate a lot of great experiences and lots of hardcore classes and things to then get me to my next step, which was going to the University of Minnesota to pursue my genetic counseling degree and my master's. Right after undergrad, so I was very lucky to go pretty quickly. And I had to find these pictures. That was my class, my graduating class of 2005, of most of whom I'm still very much in touch with and have gone on to do wonderful and amazing things. And then I had just a great friendship actually with who is now the program director at the University of Minnesota, but was the class under me, class of 2006, Heather Zierhut, who's Dr. Zierhut at this point, one of my nearest and dearest friends. So I had to put her in there because I met her at that time. And in Minnesota, one of the reasons I selected that program, and obviously programs have lots of new programs since that time, in the early 2000s when I was looking, but I had opportunities to teach. I got to be a TA. That also helped with cost too. But I wanted opportunities to teach and educate and get some more of those experiences. I wanted the opportunities to work with diverse communities, which again, kind of sets me up for where I ended up going. The Hmong community in the Minneapolis-St. Paul area and lots of diverse groups were just fabulous educational experiences for me and who I interfaced with, in my internships and when I was counseling. And they also had bioethics faculty expertise. And I came from a background of bioethics that I found beyond interesting and really was excited to kind of keep that as a thread in my education. And I just think that the program was wonderful and set me up for success as I really thought about, kind of where career opportunities could go. One thing, that I'll have in a later slide is I interviewed a lot of people during that time, even before that time, and even since, people that I really admire, people who were doing things that I thought would be really cool. And wanted to integrate into my career. I was really excited. I learned so much from people that I just said, hey, can I take 15 minutes of your very busy schedule and talk to you? And I know many of you are trying to talk to genetic counselors and do a lot of those types of things to get yourself, some of those perspectives. But I even interviewed people that weren't genetic counselors, but had, some, a career path in public health or a career path, kind of in other lines of opportunities that can dovetail with genetic counseling, just to give me some additional perspectives on maybe where more opportunities could be with my genetic counseling skills, kind of like with public policy, like that internship. So that was a really formative piece for me. And so many wonderful experiences, loved graduate school. And, it was hard, it was great, it was all the things. And I took my first job at New York Presbyterian Columbia Medical Center in New York City. So I packed up from Minnesota and drove cross country and set up shop in New York, and got to meet I actually was close to where the Sarah Lawrence campus is. So I got to meet lots of awesome students and was participating in, supervision in their program while I was there for a couple of years. In this setting, I did everything but cancer. Of course, I've ended up in cancer. But I wanted to do a lot of different things in my first job, preparing for boards. At that time, boards could not be taken in the same year that you graduated, and it could not be taken the same year as you graduated. It was every 2 years. So it looks a lot different these days. So I had 2 years to really, kind of harp on the boards that I was going to take and, really get nice and nervous. But I got some amazing experiences there. And I think a couple of things here that were really formative, where I decided, after taking several years of Spanish in school, in just middle school and high school in Texas, I decided to take medical Spanish and get a great class at Columbia, where I was able to, get a semester and a little bit more in medical Spanish. And I wanted to start counseling in Spanish. That was my goal in the year 2006. And so I did. And I had a lot of base in that, but I was able to kind of learn what I needed to. Now, I'm not formally, vetted by, translation services and all of that here at UT Southwestern, but I'm able to use it. And I was able, in a pinch, I'm able to counsel, and kind of do and communicate and do what I wanted to do. So that really, again, as we thinking about the future in Texas, that really set me up really well for that. And I had a sense that Texas was where I wanted to end up with family and things and opportunities in the area. So this was my first foray into Spanish-speaking populations. I mean, most of the population in Washington Heights, which is where the where New York Presbyterian Columbia is, was from the Dominican Republic, kind of transplants from the Dominican Republic, and lots of Spanish speakers. So lots of great opportunity to practice skills. And I also started pursuing outreach opportunities. And in this particular program, they weren't, it wasn't necessarily set up for like outreach opportunities frequently as a part of the position. And I was doing prenatal peds and metabolism. So I was doing lots of different things outside of cancer. So I seek out opportunities. So I looked at the March of Dimes, and they had opportunities to go speak in high schools and talk about genetics and those types of things. So I took those opportunities. I put myself out there and I did it. And I realized how much I loved it. And I hadn't had that many opportunities to speak outside of being a TA in grad school, but I loved giving presentations and teaching and getting people excited about this information. So I started giving myself more opportunities for those experiences, and that was really revealing to me, how much I enjoyed that. So I was there for a couple of years. Right about the time my boards were set to, I was set to take my boards. I was talking to one of my long-term mentors, Linda Robinson, and who was here at UT Southwestern and was here the first genetic counselor in the program here in cancer. And I've been talking to her, really since I knew I was going to go and get my master's in genetic counseling. And there was a position open here in the Dallas-Fort Worth area with a very small team at the time. And so I decided, you know, I'm at a place now where New York's been amazing. I've learned so much. And I feel like I'm at a place where I'm ready to make a change and also go to cancer, which is where my passion really was in grad school. So I made the move during almost boards time. So it was very stressful, but it was great. And it was the best decision I ever made because it gave me opportunities that, you know, in a program here that was looking to grow, that wanted to expand, that had leadership that was very excited to try new things. That's the environment I needed to be in to thrive. So as an incoming genetic counselor in a small group, we were 4 GCs at the time with 1 scheduler when I started in 2007. So 14 years ago now. And I was able to basically be hired as we had a little bit of a practice. Dallas is the main campus of UT Southwestern, and then Fort Worth was a smaller satellite at the time within the Moncrief Cancer Institute that you see here, which is a group affiliated with UT Southwestern, where we were not in the building at that time, but I was really hired to grow the Fort Worth side of our program. And so I was splitting time, but doing lots and lots and lots of outreach in the Fort Worth and metro area, which for those of you who don't know, Fort Worth is quite a metropolis in and of itself. It's not Dallas's little sister. It's a very unique place, all in and of itself, and actually a highly populated place. So we, you know, just really pursued programmatic development, and as a new GC, relatively and new into cancer at least, you know, but only a couple of years under my belt and experience, you know, I really was given a lot of leadership, even though I didn't have a title at the time, but I took it on and I wanted it to grow and I wanted it to be successful. And I had leadership in, you know, my mentor, Linda, and, you know, in our cancer center that really wanted to support that. So that was really exciting. So lots of speaking, lots of outreach, lots of meetings, you know, lots and lots and lots. I mean, probably 50 in the first year myself. So to just keep growing and to establish more opportunities to take over the genetic counseling services for private oncology practices. And so really working to expand our footprint in Fort Worth and the surrounding areas, which are very rural areas. So that was kind of the start of it. And, you know, so really learning through those experiences, along with my partners in our program, you know, how to plan and promote clinics, how to build relationships, how to, you know, really build trust. That goes into, if you're going to go into a practice, you know, folks are going to think, oh, you're going to steal patients for UT Southwestern. We had to prove that that wasn't the case. So I put my face on it and said, you come to me if you have any problems. Like, you know, I'm your contact, I'm your trusted colleague, you come to me. And I was able to build relationships that way and gain trust and gain trust for our team as well that was interfacing. So, you know, really growing and building, and what that led us into was thinking about our county hospitals in Dallas and Fort Worth. And they have both very robust county hospitals in both. And in fact, in Dallas, it's one of the biggest county hospital systems in the country. And so we wanted to really, there was no cancer genetic counseling, formal, robust services or offerings in either of these places. And we wanted to serve the underserved. So we really started doing that. And, you know, through that experience, you know, and kind of thinking about how you know, again, kind of build opportunities, making small steps. You know, we decided to publish a paper in a smaller journal, and I believe this was in the ACCC journal, the Community Cancer Centers, Association of Community Cancer Centers, and just publishing our experience on a descriptive experience on how we built cancer genetics programs in county hospital systems. And that was one of, I don't recall prior to that there being any major experience that was published on that, that we found in the literature. So it was really great to just take an opportunity to say, hey, here's what we did. Here's what we did. And a part of what we did was expand opportunities by going out and writing applications for grants. And so this kind of started the trajectory of this piece of our program, where we just started with Komen, our local Komen Foundation, Susan G. Komen, you know, obviously huge in the breast cancer space. And so they had grants available, and they still do to this day in different ways, but they had grants that, you know, you really could take in the realm of getting services for those that, you know, need cancer genetics risk assessment and testing costs and those types of things. And at the time there were still financial assistance programs through one of the major labs, but there was that, but we know we needed more, and the budget was not there in the county hospital budget as taxpayer dollars, that type of thing. So, that's been a bit of an uphill battle over the years. But we wrote a Komen grant, back before 2010, and we got it. And so we got money, not for the genetic counseling time or service itself, but for testing at least. So it was a step in the right direction to get resources for patients that we'd started a clinic there. We needed all the resources we could to get them the testing that they needed. And we were able to do that and build relationships with the Komen Foundation and its friends, through 3 years of grants. And then, and then they were changing a little bit of direction. So we needed another opportunity to really think about how we could continue to expand programs. And that's where our journey with this organization started. So back in 2010, the Texas legislature here in the state put funding, actually $1 billion over 10 years towards cancer prevention and research as an initiative in the state. So that was really exciting. And so it's called CPRIT. So you see here the name and CPRIT, and that's how I'll refer to it going forward, the Cancer Prevention and Research Institute of Texas. 10% of their budget is prevention. The rest is research. So we went along the prevention arm and really thought together about, how, obviously what we're doing is prevention. So let's write a grant. We're not grant writers, well, let's write a grant. And with our medical director at the time and myself and Linda and my colleagues, we wrote that first grant and got funded. And since then, we've used that to really elevate our county hospital practices to screen unaffected populations for hereditary breast. And then we moved into hereditary colorectal cancers as well. So, we were touching a lot of populations that, there's a lot of patients falling through the cracks. And then we had navigators to assess them, and to get them into clinic with a genetic counselor. We could identify those patients with testing funds and get them to where they needed to go for their risk, for risk stratification and for follow-up and medical management. So we learned how to write grants. And I always tell people when I talk about this, again, I did not learn how to write grants in grad school. I never foresaw grants in my future, but we did it. We jumped in and we didn't win all the time. We've definitely written grants we didn't get awarded, and you'll hear that from people who write grants. These weren't research grants, these were clinical prevention service grants. So it was money to fund programs that you implement, in whatever community or space that you're in. So we weren't really in the research space at that point, but we have been able to be awarded 6 times by CPRIT over the last 11 years for a variety of programs that have benefited our Dallas and Fort Worth County hospital systems and rural areas. So it enabled us to start telemedicine way before other people were doing telemedicine. In some of the Western, we have a lot of real estate in Texas, to the West, especially where there's not as many healthcare services, especially genetics touch points in those areas are pretty few and far between. So we were able to start telemedicine services and go into telephone-based services before COVID ever happened. So that enabled us to really pivot very well as a program. And we were able to, kind of lead that effort actually for our cancer center as well, and build those relationships with providers all around the area, because we had those grant funds to be able to really, get resources and get out to build relationships with healthcare providers in rural areas and start, building that genetics education too with all of these folks. So that was really critical and a huge learning opportunity for me. Again, like I said, never went to school for that, but learned how, and then also, leaned on some of my colleagues who I started to get to know through all of this that are grant writers and do this like as their full-time job, and learn from them, and learn tips of the trade and learn from the bad reviews we got at times, and and again assimilate that into hopefully continued success. So like I said, we've had successes, we've had failures, but we've learned from those failures. You have to fall to get back up and to be stronger. So we've learned a lot from those. Not to say they were always easy, but we learned a lot from those. And now we're kind of working to get a little bit more into the research space, and kind of take the, again, using our clinical prevention experience to then build towards, well, we've done these things for so many years, screening populations, building telemedicine clinics, increasing compliance of patients to their medical management when we identify hereditary breast or colon cancer syndromes, using a genetic patient navigator, which was a new position that we started to help get these patients in underserved populations where they need to go. that's now leading us into looking at these programs from a research perspective. So really kind of looking and getting an evidence base around like what's working in these underserved populations and what's not when it comes to service delivery. So again, stair steps that are building to other things as we allowed ourselves to go into spaces that we weren't necessarily planning to. Here. And, and kind of, again, in the grant space of things, we were, and like I said, I know several genetic counseling assistants in our program on the call, and several years ago, we started having genetic counseling assistants in our program as of 2011. So we've been in the space now for 10 years. And after we had a few come through our program, we, along with a colleague at UCSF at the time, we're talking about, well, they had lots of genetic counseling assistants too. It'd be great there's no literature on this in the field. Let's think together about how we can get funding for, to survey genetic counselors and former assistants and program directors, for genetic counseling programs, and get a sense for where they think this position is and what it should be and where it could be going. So again, it was a very new term at the time. And to be honest, a little bit of a controversial term at the time. So it's kind of funny to see how things have gone in different places. But we were able to get funded through an NSGC-based award called the Audrey Heimler Special Projects Award. I put Audrey's face there because she is one of the pivotal genetic counselors that everyone who's a genetic counselor should know. And she's still around, and she still has come to NSGC to the annual conference. And I've gotten to meet her when I served on the project award committee several years later. She's just a force to be reckoned with. Her stories are amazing. But we were able to get an award for this. And funny enough, we actually had one of our former assistants who is now a genetic counselor and has been for several years in our program, Parker Reed. We actually had him and another genetic counselor assistant, Sara Pirzadeh, who's now at Myriad. We had them help us write the grant. So we threw our assistants in. I'm sure my assistants now are like, oh my gosh, Sara, don't do that to us. But we totally did. And it was great. And then, of course, us as the genetic counselors, we were all in it together, but we got them as assistants in the mix, to get, their names on things, that's going to help them from a CV and forward progress perspective, but B, really getting them on the ground with some experience that you don't always get, in your training. So that was really, really cool to be able to have that opportunity, which then led to us publishing the paper on that data. That since then, this was really kind of the first major paper in the GCA space, kind of talking more about that particular topic. And then since then, lots of great papers that have come out and people really looking at this and the position being more formalized, in the sense that it is now with a lot of different groups. So it was great to be able to kind of get some initial data out there and again, kind of elevate us, and as the first author on the paper, I was given a lot of opportunities then to then come speak about it and talk about our experience and different national conferences and different things. So that was really exciting to be able to, be seen as an expert in that space, in that conversation, because we took the steps to get ourselves into that position too. And, some of these lessons that I live by here are things that I've kind of mentioned a little bit throughout, but a couple of things to mention, as we think about just our program here at UT Southwestern, and I've talked about some of the innovation, with the grant writing that we've put ourselves into and getting grants to, elevate our services and get to other populations and positions we put ourselves in, which has allowed for growth, as a leader, from the time that I took over this associate director position, we went from 8 to 16 genetic counselors. We've had a lot of growth in the last few years, more GCA positions, scheduling team members. So we're now a team of 32 all in, and we started as a team of 4. And so it's been so cool to watch that grow over the years and to be in leadership for a good chunk of that time, kind of helping us get to where we need to go. And, and as part of my leadership roles, I started as a supervisor, again, because I was doing a lot of that as I built the Fort Worth side of the program or was a part of that. And then as we grew and as I kind of went up into the leadership positions, we really had to evolve the program. We really had to say, okay, we have a bigger program now. 1 or 2 leaders isn't going to cut it. We need to build in manager supervisor positions over different groups for our grants, for our GCAs, for our GCs that were in different places as the GC team grew. So, we were able to build, and then for our scheduling team, a supervisor for them. So that has allowed GCs in our program to have growth as well. And that is one of several ways that we build growth for GCs into our program. And that's really important, of course, as we think about, sorry there, I don't know if that came up on your screen. There we go. As we think about kind of growth and evolution of a cancer genetics program or of any clinical genetics program, those are really critical pieces as we think about retention and how we grow. And we also evolved into new positions. So I mentioned earlier that we, through our grant work, and as we screen populations like mammography clinics, GI screening clinics, for their family histories of cancer to identify high-risk patients, I mentioned a genetic patient navigator, and we built in this genetic navigation program that kind of has come out, and we actually got another secret grant to fund the work of a genetic patient navigator, which really wasn't published in the literature at the time, and is a person who we've now it's an oncology nurse who was a navigator, and in our case, on our team, Kathy, who is just an amazing person in this space. And she is the person that once we identify a mutation positive individual, especially in our underserved clinics, she is the person that is, that is really helping kind of take them to the next level. So especially our underserved patients, they have other barriers that they're dealing with life-wise and resource-wise. And so helping them get to, you need that breast MRI, how can we get you there? You need a colonoscopy. That process is difficult and there's a long wait and finances are an issue. Let's think about how we can work on that together, and really hand-holding in a lot of cases for these really high-risk patients. So we've kind of built a navigation program and other kinds of genetic navigators as well. And that's been a new and exciting space to be in, that a lot of people are reaching out to us to say, like, well, how did you do that? And what does that look like? And we're actually working to create similar programs with partner institutions as well. So that's been a really exciting kind of new piece of things that, has allowed us then to kind of build off of that into other potential, programs and projects and different things. So from the GCA perspective, we talked about how, we got that award a few years ago to study, kind of get surveys going to kind of understand nationally what people were thinking about the position. And, and since that time, as our GCA team grew, we really thought a lot about, I went from having to beg for folks to apply for these positions years ago to, we have so many amazing candidates, it is hard to pick. And so it's like a wealth of riches when it comes to just these amazing applicants. And so we have these amazingly strong GCA teams, people that want to go to grad school, people that want this experience. And so we really want to serve them right. And so we built in new programs into our own program to serve the GCAs. So, an education component that we have a GC lead, as kind of a coordinator position. A mentorship program that's also led by another GC, where we connect our GCAs with current GCs, and we kind of have a whole mentorship program so they have a point of contact throughout their time with us. So they usually leave us after a year because they're amazing, and we try to boost them up with as many experiences and help as possible, and then hire some more, in the coming year. But we've kind of built a GCA focused program, like a sub program within the big one. And that's been a really exciting piece. And we've been talking to lots of programs around the country who are doing GCA mentorship. And, and learning from them, and they're learning from us. And that's been like another space, that's kind of been developing, and we're publishing on it as well. So, again, more opportunities to get yourself out there. So, to get back to the lessons I live by, and I've talked about a lot of this already, but getting your name out there as a subject matter expert, as we think about opportunities for building leadership opportunities for yourself or for anyone, part of that is getting your name out there however you can. So, abstracts at NSGC or other conferences, even if they don't turn into manuscripts, you have colleagues seeing your name on these things and then coming to you for expertise, presenting your work wherever you can present your work. We've presented in lots and lots of different conferences outside of NSGC as well, and to groups around the country, healthcare provider groups, patient groups, all kinds of things. So making yourself that subject matter expert. Like I mentioned, little moves can turn into big moves. Again, that stair step, okay, we tried this thing. Okay, now we can build it into this thing. And then before you know it, all these things have happened over a span of time that have built into this bigger thing that you never would have imagined. I know genetic counselors have a hard time saying no. I don't say no that often because I don't want to close the door on an opportunity. And there's so many times where I've said yes, especially to something that scares me, that has allowed me to get a new experience, to learn, to grow as a professional, and then meet new people that then, again, it kind of dominoes into other things. You meet somebody in a certain place. Oh, well, it's been great to get to know you here. I think there could be a cool opportunity for us together to work on this. So those types of things are huge. Learning, I mentioned interviewing people, learning from as many people as you can. I'm so glad you all are here today to learn from one particular experience. But gosh, interview, talk to folks as much as you can. And I know all of you are trying hard, and it's not always easy to get the time of a genetic counselor in a crazy time and world that we're living in, but keep trying, keep pushing, and also talk to folks that aren't genetic counselors, but are in spaces that could dovetail nicely with genetic counseling, and where you want to go. And I very much did that, like public health professionals and things like that. And I have to end with do something that scares you. I mentioned it a couple times, and I tell you, you will be scared, and you could be scared now. Just kind of thinking about where's life going? How can I get to where I want to go? I had those feelings too. And not to say that I still don't have those feelings now. Obviously, lots happened since then. But you got to get a little uncomfortable to go somewhere really, really good. And there's going to be missteps along the way. You're going to fall. You're not going to always be successful. I know I have not always been successful. But what I have done is learned from every experience. And even if something just broke my heart at the time, and oh shoot, I wanted that grant so much, and I'm super disappointed, I've put in so much work, but I'm learning from those reviews. I'm learning from the experience of my colleagues around me. I'm getting people's opinions, and I'm building to something better. And that's not only me, that's my team. That's anyone I'm working with. And so, really not only boosting yourself up, but boosting up the people that are working with you is so critical for success. So get a little bit uncomfortable. You're going to do something right if you're getting a little bit uncomfortable and doing things that you haven't done before. That's what I have at this point. I know we're at about the 40-minute mark. My Gene Counsel team, if you have questions or anything else from here, I am happy to discuss.
Well, thank you, Sara. That was fantastic. And I think gives people a taste for how to get into the field. And once you're in the field, how to find the little opportunities that you can build on. Maybe what we'll do for all of those of you watching who have questions for Sara about her career path or about the field of genetic counseling, please write those questions in the chat. And in the meantime, I'm going to see if our genetic counselors have any questions for Sara.
It looks like people are adding to the chat now, but just to kick us off, one thing I hear from prospective students a lot is there's a lot of opportunity within genetic counseling, not just in different roles, but even within clinical genetic counseling, different specializations. How did you figure out what you wanted to focus in? And did you feel ready to pivot from those areas to oncology once you had an opportunity?
Yeah, great question, Megan. I'll say that when I was in my training at Minnesota, I definitely felt the excitement about oncology, but I was very much in my first job wanting to get the widest breadth of experience, knowing that I had 2 years to prepare for my boards the way things were designed. So I really wanted I was young and unattached to anything that kept me in one place. And so I just wanted to go where there was a cool life experience, where there was an amazing opportunity to learn from amazing people. And I did that. And so I knew though, as I went into that position, that I didn't know where life was going to go, but I had a feeling that at some point I'd probably want to get back to cancer. And so while I won't say that I was studying for boards, so I was on top of things at the time. When I then moved into the opportunity at UT Southwestern, I had to get up a little bit more as I came on board, just to kind of make sure I was perfectly on point with where I needed to be, for my clinical skills and to serve the patient populations. But I definitely felt ready. Now, if it were me now, going into another, being in oncology for more than 14 years, and let's say I wanted to go jump back into the prenatal world, I'd have a lot of learning to do. I'm very not well practiced in the space. And so I'm always, deferring to my great colleagues who are, but I'd have a lot of studying to do and a lot to get up on. So I guess for me, and there's some comfort level issues there, but I definitely, at least back in the early part of the career, was ready to jump where I needed to jump and felt ready to do that, because I also wasn't that far out of school, studying for boards, all those things. But now I would, if there was an opportunity and if that made sense, which there definitely is not anywhere else I want to go right now, I would be ready to do that and prepare myself to do that and know that I can rely on the skills that I have to be able to make those pivots, if that helps answer the question.
No, that's perfect. Helpful.
And Sarah, as students are thinking about the application cycle is coming up and kind of looking at their resume and thinking about how they might spend some of their time in their, early in the semester, what do you think would be the number one thing that they could do to improve their applications for graduate school?
That's a great question. And we talked to our assistant team a lot about that because they're in that space, every cycle of assistance that we have. And I think experience as whatever experience you can get, when it comes to whether it's shadowing opportunities, however that might look, interviews with genetic counselors, however that might look. That can be a phone interview, that can be something, video based, that can be in person, whatever that is. Any experiences that you can accumulate. Now, again, this isn't like the linchpin, like you're going to get in or you're not, of course. But as I talk to our assistant team and as our team does, one thing we're always even telling them, like on their CVs, record everything that you've done, when it comes to interviewing people, shadowing experiences, give the detail, put how much time did you spend? Who was that with? What did that look like? So that, even as somebody who hires GCAs, I'm looking at those applications like I'm a training program, because we want to hire the folks that we know can go the distance. We know it's just a matter of time. So we look at it that way too. And myself and others are always telling folks, if I'm not seeing that on your resume, I don't know what you did. And I think that's a really important piece as you think about your preparation and readiness to know, A, you want to be a genetic counselor because you've exposed yourself as much as you can to experiences, and B, what has that looked like for you and what does the breadth of that look like for you so that we can appreciate that as we're looking at resumes.
Great.
Sarah, a question came in that's almost from a patient perspective. I've had physicians oppose genetic testing for me and my family members because they are not aware of the guidelines for genetic testing and told me that my knowledge of the NCCN guidelines, which I work with daily, is inaccurate. What do you think can be done to help provide resources and guidelines for genetic tests for physicians to help ensure that patients are not being overlooked when they qualify for testing?
Oh, that's a great question. That's a great question. And that's really what we're doing every day, in a clinical program, at least our program. One big focus we have is continuous education and repeated education to our stakeholders and colleagues, internal to the institution and external to the institution, because we interface in the community. I mean, half of our program is really in the community, different practices, working with lots of different kinds of healthcare providers. And, and then you have fellows, you put that in the mix and fellows turnover. So you educate fellows and then you get a new crop of them in July. And, so the education never ends. And so to this point, it's a lot of work and, and it's a process, but, what we do at least is, whenever the NCCN guidelines update, which they do all the time, we're compiling those changes and we're sending them out to our stakeholders and folks that refer to us and folks that we know, and internal and external to our institution, so that it keeps it, again, as top of mind as it can be. Getting NCCN guidelines on their phone, the app is so awesome. I was actually we do intro meetings with our new faculty coming on and new healthcare providers coming into the institution, and I meet with all of them, so they know that we exist and who we are and what we do. And I was just telling somebody the other day about the app that I didn't know was there for a long time, and we're an NCCN affiliated institution as of late. So just kind of giving them tools of the trade so that it's a top of mind, making things as easy on them as possible to think about it. And, the other thing too is one thing that we talk a lot with healthcare providers about these days is, given that, at least in the cancer space, the out-of-pocket price has gone down so much in terms of folks who don't have insurance coverage for genetic testing, or, that might be an issue to meet guidelines. I always tell our healthcare provider colleagues, and again, these are people that are actually thinking about it, refer them to genetic counseling anyway. Don't harp on the guidelines. We know the guidelines aren't perfect, and we can highlight data to show that the guidelines aren't perfect. So they're a guidepost to me versus a guideline. So, have those conversations and make sure that folks know that they, especially, from the patient perspective, being your own best advocate is sometimes really the best thing that you can do. But I know as providers, we're doing the best we can to educate colleagues as well, to make sure that, at least we've done everything we can do to help folks not fall through the cracks.
Excellent. Another great question just came in, Sarah. What qualities are you looking for in prospective students or assistants, not just in CVs, but also in personal statements, reference letters, or interviews?
Yeah, that's a good question. And I think about that in the lens of, how we think about hiring our assistants, like I was talking about earlier, because, that's where they want to go as well. And some of the things that are not just on the CV, but I think are just important. A couple of things come to mind. One, as we coach our assistants, and help them understand, kind of a really impactful personal statement, one of which is really making yourself stand out, because you have programs that are going to read 1 million letters and things are going to blend in over time. But think about what makes you unique and pop that out at the beginning of the personal statement. So like, I want to remember. And as I think about the assistant prospective candidates, we're, in kind of what they send to us, we're looking, it's not a personal statement, but we're kind of looking for those opportunities, like what stands out to me in addition to a good CV, and so as we think about personal statements, what makes you unique? Tell a good story, make yourself, really, really stand out, and really kind of show that you're not only smart and you look great on paper, and all of those great things, because a lot of people do, but when I interview folks, we're also looking for people that can be, can they lead and can they work in a team? Kind of thinking about that, the aspects of their personality that are going to lend themselves well to success, especially as you think about, so many teams that you work in, and, and always going into those types of environments, those types of things are really important, as we just kind of think about, the interview process, making that really apparent, as you go through an interview process. So I could go on and on. A couple of those things come to mind as really impactful.
Thank you. What is something that you hope that future genetic counselors will contribute to the field?
Oh, we talk about this a lot. So I sit on the board of directors currently for NSGC, and as we formulate our strategic plan, as we just were doing this summer, we were thinking a lot about that. Like, what does the world look like 3, 5 years, 10 years from now? You have to think on that strategic level. And I think one place where what I want to see from the profession is ongoing outcomes research, showing how we are impactful in any space. And more genetic counselors realizing, and I'm doing this literally at this part in my career right now, is putting my toes into the research space. Nothing that I ever was really super passionate about coming out of school. But what I've realized over time is, if I want to be impactful, if I want to make a mark and push things forward, research is important. And, and that might sound kind of like simple, as I say it, but being able to show with data, with evidence, like, what is our impact as genetic counselors, that's going to propel us forward on so many levels if we can continue to increase that literature and really be able to show that when a genetic counselor is involved, outcomes are better. And here's why, and here's what about us is pushing us forward. And that also is going to increase the longevity of our profession, which I could also go off on. But I think we need to think about all of those elements. And I think that that's a space that we're going to have to be, we definitely have a lot of growth there. But I really think that research, that data-driven element is going to be a really critical piece as we think about genetic counselors in our profession. And proving ourselves sounds tough, but I think that is something we have to think about, proving ourselves moving forward.
So Sarah, let me push that just a little bit more. Many of the people listening today are either college students, some are high school students, some may be people who've pursued a second career and going back and taking coursework. What courses would you recommend that would help them prepare themselves to be good researchers as genetic counselors?
Yeah, that's a great question. And you know what? I wish I had the time and bandwidth to do this myself, actually, and refresh myself. But really, you would take this in genetic counseling programs as well, but statistics, really kind of diving into the quantitative piece and taking classes that are going to really beef up your, your understanding and application of statistical methods in research. I find for myself that that's actually a place, as I've kind of put my toes in the space, I've had to really lean on some of my colleagues that actually are now PhD level genetic counselors, or they have their PhD degree and are genetic counselors as well. And they get a lot of that in their PhD training. And that really helps them move forward, especially if they're excited about, the research base and getting funded. So I've actually kind of gotten some crash courses from some friends that have helped just kind of refresh my memory and really think about how it applies to projects that we want to push forward. So as I think about classes back then, I definitely took a statistics class, but I didn't really think about the practical application in a real way, like what that would look like professionally. And I couldn't have known, of course, at the time. But I would say, that really those getting really beefed up on the quantitative elements of data analysis, critically looking at, data yourself and being able to interpret that in statistical methodology, whatever exposure would be great.
You
Sara,
also, I'm sorry, go ahead, Danielle.
I was going to move on to the next question. Did you have a follow-up?
I was just going to say that, Sara, you also mentioned earlier in the talk that you had taken Spanish and had learned. Do you think knowledge of Spanish for people going into the field of genetic counseling is important?
Absolutely. And it's never, I don't think it's ever been highlighted as well as it is right now. In the world of really being better stewards and recognition of justice, equity, diversity, and inclusion efforts, especially in the genetic counseling profession, this is just a huge piece for us, and it will be an ongoing huge piece for us, for the profession moving forward and for our society. I feel like taking Spanish and being exposed and immersed in the cultures, that I've been able to expose myself to with diverse patient experiences has been so critical in my appreciation and understanding of just different viewpoints and how we can serve patient populations better, and meeting them where they are. And taking Spanish back in the day, never knew I never, of course, thought about applying it that way. I was just doing some of it because you had to do it in school. But luckily I picked up languages pretty easily. And so, Spanish for me, being in Texas, obviously a huge helpful component. I really think that led all of that work, to really setting me up for success, to really do a better job meeting patients where they are later.
Thank you.
I think this next question has come up to all of us as genetic counselors and is becoming more and more frequent as the field, particularly as it gets more competitive. Mm-hmm. But for second-time applicants, do you have suggestions for them kind of going into the application cycle?
Yeah, Danielle, that's a great question. And, and I'm thinking just on our personal experience here in the program, we've had that situation arise for our assistant team members in the past over the years. And, the advice that we, really give is, think about how you've grown in the last year since your last application and really highlighting that. So especially when you're applying to similar programs or same programs that you did in the first cycle, really highlighting, or maybe you talked to program directors after the first cycle didn't work and you got some advice and some thoughts and some feedback, really highlighting that and say, I did this work. I understood, areas that I could grow, areas that I could get more experience. And here's what I did, not bullet points in a personal statement, but, but just really like pointing it out really distinctly to say, I put in the work, I've put in the time. Here's what I've learned. Here's how I'm better. And I'm a better applicant this cycle than last. And also too, I think, expanding your horizons from a program perspective. So depending on what that looked like in the first cycle, probably new programs have started since then because it's just been burgeoning at this point. So just kind of thinking about too, if you can cast a wide net, and maybe think about opportunities that you weren't thinking about the first time around, or maybe that you've learned since the first time around, like, oh, I think I'd be interested in a program in this area, or, with this in their curriculum or whatever. Just kind of think about the program application choice as well, as you think about the second cycle. So those would be a couple of things I consider.
Sara, you shared with me, I know you've got clinic today and that you've got a patient yourself in a few minutes. So we want to be respectful of your time and really thank you so much for joining us today. I'm also going to put up some information that we have for people interested in the field. And this is a helpful toolkit that we have for students in the field. And we have a few other slides, but Sara, I know you need to run. So thank you so much for being here. And this is available on recording and will be sent to everyone who signed up for this webinar. You'll have that link within 24 hours if you've missed any part of this. So thank you, Sarah.
Thank you so much for having me. I enjoyed it immensely.
Fantastic.